Hello, everyone, and welcome to the Sarita Air Crew Official. Today, we're talking about TSA screening for travelers over 70, and I know that title might sound a little intimidating. But I'm not here to scare you or make airport security seem more complicated than it needs to be. I'm here to empower you with information that will make your next trip through the airport so much smoother and less stressful. As a flight attendant with 15 years of experience, I've walked through TSA checkpoints literally thousands of times, and I've seen firsthand how confusing and overwhelming the process can be, especially for our senior travelers. But here's what most people don't know. There are specific accommodations, rights, and insider tips designed specifically for travelers over 70 that can make the entire experience easier. The problem? TSA doesn't exactly advertise these things, and most travelers have no idea they exist. Today, I want to share 9 facts that every traveler over 70 should understand before their next flight. These aren't just tips. These are things that could genuinely transform your airport experience. So let's dive in. Let's start with something that absolutely blows my mind. Most travelers over 75 have no idea about the special screening modifications they're entitled to. Here's the truth. If you're 75 or older, TSA has implemented specific procedures that are designed to make your screening experience faster and more comfortable. In my 15 years flying, I've watched countless senior passengers struggle through standard screening when they could have had a much easier time. Here's what happens when you're 75 or older. You're allowed to keep your shoes on. Yes, you heard that right. You don't have to bend down, struggle with laces, or worry about losing your balance while standing on one foot trying to remove your footwear. But it gets even better. You're also allowed to keep a light jacket or sweater on during screening. Now, I know what you're thinking. Sophia, why didn't anyone tell me this? Trust me, I ask myself the same question every time I see a 80-year-old passenger struggling to remove their shoes while juggling their belongings. Here's what we flight attendants see all the time. TSA agents don't always announce these accommodations because they're processing hundreds of people and moving quickly. It's not that they're trying to hide it, they just assume you know. But knowledge is power, and now you know. When you approach the checkpoint, if you're 75 or older, you can politely mention your age. Most TSA agents will immediately adjust their instructions. There's also something else you should know about TSA PreCheck. If you're over 75 and you already have TSA PreCheck, you get even more benefits. But here's my honest advice. Even without PreCheck, those age-related accommodations can make a huge difference. I once had a passenger, Margaret, who was 78 and had been dreading her flight for weeks because of the security checkpoint. When I told her about these accommodations, her entire demeanor changed. She went through screening with her shoes on, kept her light cardigan on, and told me afterward it was the easiest airport experience she'd had in years. Now let's talk about something really important: medical devices and implants. This is where I see the most confusion and anxiety from senior travelers, and I want to clear things up once and for all. If you have a pacemaker, defibrillator, insulin pump, or any internal medical device, you absolutely need to inform the TSA agent before you go through the screening equipment. Here's why this matters. Some medical devices cannot safely go through the metal detector or body scanner. Your doctor should have given you a card or documentation about your device, and I strongly recommend keeping it in an easily accessible pocket or in your hand as you approach security. Here's what most people don't realize. TSA agents are trained to handle these situations every single day. You are not an inconvenience. You are not slowing anyone down. Your safety is the absolute priority. When you inform them about your medical device, they'll typically offer you alternative screening methods, usually a thorough pat-down in combination with ETD. That's explosive trace detection, where they swab your hands. In my experience, the passengers who have the smoothest screening are the ones who speak up immediately. I've seen travelers try to hide their medical conditions out of embarrassment or fear of holding up the line, and that actually creates more problems. The body scanner might detect something, which triggers additional screening anyway, but now the TSA agents don't have the context they need to help you efficiently. Let me share a story. I once flew with a gentleman named Robert who had both a pacemaker and a knee replacement. He was terrified of the screening process and almost canceled his trip to see his grandchildren. I told him exactly what to do: carry his medical device card, inform the TSA agent immediately, and request a pat down. He followed that advice, and he told me later that the TSA agents were incredibly professional and accommodating. The whole process took maybe 5 extra minutes, and he felt completely comfortable the entire time. One more critical thing: if you have metal implants from joint replacements, hips, knees, shoulders, these will absolutely set off the metal detector. Don't be surprised or embarrassed. Just let the TSA agent know beforehand. They'll likely use a handheld metal detector to locate the implant and then proceed with additional screening if needed. Medications are one of the most common sources of confusion at TSA checkpoints, and I'm going to give you the insider knowledge that will eliminate that stress completely. Here's the official rule: medications in pill or solid form are unlimited. You can pack as much as you need in your carry-on bag, and you don't need to declare them or place them in a separate bag. They can stay right in your carry-on as it goes through the X-ray machine. Now, liquid medications are different. We'll talk about those in a moment. But your daily pills? No problem whatsoever. But here's what I always recommend, and this comes from seeing too many problems over the years. Keep your medications in their original prescription bottles with the pharmacy labels clearly visible. I know those bottles are bulky, and some travelers like to consolidate everything into a pill organizer. You're technically allowed to do that, but here's the reality. If TSA needs to inspect your medications for any reason, having those prescription labels makes everything faster and easier. Also, and this is really important, always pack more medication than you think you'll need. The rule of thumb I tell everyone: if it's a 7-day trip, pack 10 days worth. Flight delays happen, connections get missed, and the last thing you want is to run out of critical medication because your travel plans changed. I've seen this happen more times than I can count, and it's heartbreaking when it's something like blood pressure medication or insulin. Here's another insider tip: keep your medications in your personal item, not your larger carry-on. Why? Because if there's any chance your carry-on bag needs to be gate checked when overhead bins fill up, you want those medications with you at all times. Never, ever check critical medications in your luggage that goes in the cargo hold. Bags get delayed, lost, or rerouted, and you cannot risk being separated from your medications. One passenger I'll never forget was Eleanor, an 82-year-old woman taking her first solo flight in years. She had packed all her medications in original bottles, in her purse, with a typed list of everything she was taking, including dosages and her doctor's contact information. Was all that necessary? Maybe not technically, but when she mentioned to me how confident she felt going through security, I realized that being overprepared gave her peace of mind, and sometimes that peace of mind is worth the extra effort. Let's talk about something that many seniors find uncomfortable, but absolutely need to understand: pat-downs and your rights during the screening process. This is where I really want to empower you with knowledge. First, here's the truth. You have the right to request a private screening at any time. If you're selected for a pat-down and you'd prefer not to have it done in the open screening area, you can simply say, "I'd like a private screening, please." TSA is required to accommodate this request. You also have the right to have a companion or witness present during the private screening. Here's what the pat-down involves. A TSA agent of the same gender will use the back of their hands to check areas of your body where something could be concealed. They should explain everything they're going to do before they do it. If at any point you don't understand what's happening or you're uncomfortable, you can ask them to stop and explain. Now, I need to be honest with you. Pat-downs can feel invasive, especially if you have mobility issues or sensitive areas due to medical conditions. But here's what most people don't know. You can tell the TSA agent about those sensitive areas beforehand. If you have a recent surgery site, an ostomy bag, a catheter, or any medical condition that makes certain touches painful, tell them. They're trained to work with you. We flight attendants see this all the time, and the passengers who advocate for themselves always have better experiences. I remember a woman named Dorothy who had recent hip surgery and was worried about the screening. She politely but firmly told the TSA agent about her surgery, showed her surgical scar documentation, and explained which areas were still tender. The agent was incredibly careful and modified the screening approach. Dorothy later told me she'd been dreading that moment for weeks, but it ended up being completely manageable. Here's another important right you have. If you feel a TSA agent is being inappropriate or unprofessional, you can ask for a supervisor. This is rare. The vast majority of TSA agents are professional and respectful, but you should know you have this option. Never feel like you have to tolerate treatment that makes you feel disrespected or unsafe. We touched on this briefly, but I want to dive deeper into the shoe situation because it's one of the biggest sources of stress for senior travelers, and there's so much confusion around the rules. Here's the official policy. Travelers 75 and older can keep their shoes on during standard screening. But here's what I've learned from watching thousands of people go through security. Even when you're entitled to keep your shoes on, sometimes TSA agents will ask you to remove them anyway, especially if the metal detector goes off, or if your shoes have thick soles or metal components. So here's my insider advice. Wear slip-on shoes with minimal metal. Even though you might not have to remove them, having shoes that are easy to take off and put back on eliminates stress. I've seen too many seniors struggling with elaborate lacing systems or tight boots, trying to balance on one foot, and it's genuinely dangerous. One fall at a TSA checkpoint could derail your entire trip. If you use a cane, walker, or wheelchair, listen carefully. These devices must be screened, but you should never be left without mobility support. TSA agents should screen your assistive device while you're seated or supported. If they ask you to walk through the metal detector but you need your cane to walk safely, you can request alternative screening. Don't ever feel pressured to do something that might cause you to fall. Here's a perfect example. I once witnessed a 77-year-old gentleman named Frank who used a cane. The TSA agent asked him to walk through the metal detector without it, and Frank looked terrified. I quietly suggested he speak up and request assistance, which he did. The agent immediately apologized, had Frank sit down, screened his cane separately, and then helped him through alternative screening. Frank maintained his dignity and his safety, and it took maybe 2 extra minutes. The 3-1-1 liquid rule, you've probably heard about it, and maybe you're confused about how it applies to medications and medical supplies. Let me break this down clearly because there's a medical exception that many seniors don't know about. The standard rule is liquids, gels, and aerosols must be 3.4 ounces or less, all fitting in 1 quart-sized clear bag. But here's the critical exception. Medically necessary liquids are exempt from this rule. That means your liquid medications, eye drops, saline solution, insulin, or any other medical liquids can exceed 3.4 ounces and don't need to fit in that tiny bag. However, and this is important, you must declare these items to the TSA agent at the beginning of the screening process. Take them out of your bag, place them in a separate bin, and tell the agent, these are medically necessary liquids. They'll likely test them using special equipment or do a visual inspection, but you're allowed to bring them. Here's what I see passengers mess up all the time. They try to hide medical liquids in their bags, thinking if TSA doesn't see them, they won't have to explain them. But when those liquids show up on the X-ray, it triggers additional screening, bags get searched, and the whole process takes longer. Always be upfront about what you're carrying. Let me give you a real-world example. I had a passenger named Alice who needed to bring a full bottle of prescription cough syrup, definitely more than 3.4 ounces. She was convinced TSA would confiscate it. I told her to declare it as medically necessary right at the start. She did. The TSA agent tested it with a small device, and she was cleared in under a minute. No problem whatsoever. Also, if you're traveling with liquid nutrition supplements like Ensure or similar products, those also qualify as medically necessary if they're required for your health. Just declare them. The key is being transparent and proactive. Here's something that might surprise you. TSA agents aren't looking to give you a hard time or catch you making mistakes. What they're actually looking for is safety threats and prohibited items. Understanding this can completely change how you feel about the screening process. TSA uses something called behavior detection. They're trained to observe passenger behavior for signs of stress that seem disproportionate to normal travel anxiety. Now, here's the thing. If you're nervous because you're worried about doing something wrong, that nervousness is completely normal, and TSA agents understand that. What they're watching for is something different entirely: evasive behavior, extreme nervousness that escalates, or behavior patterns that suggest someone might be carrying something dangerous. So here's my advice: be calm, be honest, and be cooperative. If you make an innocent mistake, you forgot about a water bottle in your bag, or you didn't realize your hiking knife was still in your backpack pocket, just be honest about it. TSA deals with honest mistakes all day long. They're not going to arrest you for accidentally packing nail clippers in the wrong pocket. What I've learned from talking to TSA agents over the years is that they genuinely appreciate passengers who communicate. If you're unsure about something, ask. If you realize you made a mistake, say something. The passengers who have problems are the ones who try to argue, lie, or become belligerent. As long as you're respectful and honest, you're going to be absolutely fine. I'll never forget a conversation I had with a TSA supervisor who told me, "We see hundreds of seniors every day, and they're usually our easiest passengers because they follow instructions and ask questions when they're confused. We wish everyone was like that." Here's the most important tip I can give you, and it's something I wish every senior traveler knew. You can request assistance at any point in your airport journey, including through TSA screening. If you need help, ask for it. There is absolutely no shame in requesting wheelchair service, additional time, or a TSA agent to help you gather your belongings after screening. Most airports offer what's called passenger assist services. You can request a wheelchair or electric cart to help you get from check-in all the way to your gate, and that includes assistance through the TSA checkpoint. The person assisting you can help you place items in bins, collect your belongings after screening, and navigate to your gate. This service is typically free or very low cost, and it can make an enormous difference in your travel experience. Here's what I see too often: senior travelers struggling because they're trying to prove they can handle everything independently. I understand that desire for independence. It's admirable. But here's the reality. Airports are huge, TSA checkpoints are hectic and fast-paced, and there's no prize for making things harder on yourself. Using available assistance isn't a sign of weakness. It's smart travel planning. When you book your flight, you can request wheelchair assistance. You can also request it when you check in online or when you arrive at the airport. Just approach the airline counter and say, "I'd like to request wheelchair assistance." They'll arrange for someone to meet you and help you through the entire process. I flew with a couple last year, Martha and George, both in their late 70s. Martha had requested wheelchair assistance even though she could walk short distances. George was skeptical at first, thinking it was unnecessary. But after their trip, George told me it was the best decision they'd made. The assistant helped them navigate the airport efficiently, got them through security without stress, and they arrived at their gate calm and ready for their flight, instead of exhausted and anxious. One more thing, if you have any concerns about your ability to handle the security process, you can call the TSA Cares helpline at 855-787-2227 at least 72 hours before your flight. This is a dedicated helpline for travelers with disabilities, medical conditions, or other circumstances that might need special accommodation. They can arrange for a passenger support specialist to help you through screening. Not enough people know this resource exists, but it's there specifically to help you. Let me leave you with one final chapter that ties everything together. Preparation is your secret weapon for stress-free TSA screening. Here's my pre-flight checklist for senior travelers. Before you leave home, make sure your medications are in original prescription bottles and pack them in your personal item. Create a simple list of your medications, including names and dosages, and keep it with you. If you have medical devices or implants, have your documentation easily accessible. Wear slip-on shoes and comfortable clothing without excessive metal buttons or accessories. Arrive at the airport with extra time. I recommend arriving at least 2 hours before domestic flights and 3 hours before international flights. This gives you time to move at your own pace without feeling rushed. When you get to the TSA checkpoint, take a deep breath. Remember, you know your rights, you know what to expect, and you have every right to ask questions or request assistance. As you approach the screening area, start preparing early. Have your ID and boarding pass ready. If you're 75 or older, you can politely remind the TSA agent and mention you'll be keeping your shoes on. If you have medical devices, inform them immediately. If you have medically necessary liquids, take them out and declare them. Here's something I always tell passengers. Everyone at that checkpoint has gone through before, and everyone was nervous their first few times. The TSA agents have seen it all, and they want to help you get through safely and efficiently. You're not bothering them by asking questions or needing a little extra time. One of my favorite passengers was a 73-year-old woman named Ruth, who was taking her first flight in over a decade. She was terrified of TSA screening because she had a pacemaker and took several medications. I gave her all these tips, and she actually made herself a little laminated card with reminders. She told me later that having that preparation and knowledge made her feel like she had control over the situation instead of feeling like the situation was controlling her. That's exactly what I want for all of you. So there you have it. 9 TSA screening facts that every traveler over 70 should understand. Let's quickly recap the most important points. If you're 75 or older, you can keep your shoes on. Always declare medical devices and medications up front. You have the right to request private screening and assistance. Medically necessary liquids are exempt from the 311 rule. And most importantly, never hesitate to ask for help. I want you to feel empowered the next time you travel. You're not a burden, you're not slowing anyone down, and you deserve to travel safely and comfortably. These accommodations and rights exist specifically for you, and there's no reason not to use them. If you found this information helpful, please subscribe to the channel so you don't miss future travel tips and insider advice. I'm here to make your travel experiences better, and I have so many more tips to share with you. Let me know in the comments if you've had any experiences with TSA screening, good or bad, or if there are specific travel topics you'd like me to cover next. Remember, knowledge is power, and now you have the knowledge to navigate TSA screening with confidence. Safe travels, everyone, and I'll see you in the next video.